If you're having an episode of vertigo, this is the video you want to watch. Now, I gotta let you know, if you're in the spins right now and you want all these tips, check the notes below because we've got a cheat sheet you can download for free. I'm Dr. Gregg Gerstin with Align Wellness Center, and I've been helping people to live a life of optimal health and well-being through natural means focused in corrective chiropractic care for the last 17 years. We've helped thousands of people get back to the life that they want. And today I want to talk with you about some of the key steps that we've found in helping people to eliminate the blockages that are causing them to have reoccurring episodes of vertigo and to start to get back to life. If you like videos like this or you know someone who's going through vertigo, can you please share this with them? Also, if you like videos where we talk about health conditions, we go through what you can do at home, and then we go through when you need professional help, go ahead and subscribe to our channel. We're constantly producing videos like this so that you can get the answers that you need and be an empowered health consumer. Now, on to the steps. One thing that often gets overlooked as it relates to vertigo and dizziness and getting out of an episode winds up being hydration. What I find is that most individuals in America and around the world are what I call chronically dehydrated. This winds up happening if you wind up going, let's just say a year, and you get half the amount of water that you should. After a year, that winds up being a lot. Now imagine if you did it for 10 years, or if you didn't even drink any water, you just drank soda. Our bodies are 75% water, so we need to make sure to replenish it. And the amount of water that we should be consuming is equal to our body weight in pounds divided in half. That's how many fluid ounces you should be consuming. So if you're watching this around the world, I'm going to apologize. Open up on your browser a calculator that can convert to whatever measurement system you use. But what I know is that I weigh 200 pounds. So I should be consuming 100 fluid ounces of water a day. What I like to do is I get a water bottle and I know the size. So this is about 20 fluid ounces of water. I know I need to consume at least 5 of these a day to make sure that my hydration levels are normal. Now, if you're in a hotter climate, if you work out intensely, if you drink coffee or other beverages, you'll need to add that much to your fluid total for the day. Here's the tip on how to get there if you're not there yet. Don't go jumping into drinking 100 fluid ounces tomorrow if you don't drink any. Add 1 cup of water a day for a week. So at the end of the week, you're drinking 1 cup of water. Then the next week, add a 2nd cup of water and do that for a week. Progressively continue to do this till you're up to the amount that you are needing to wind up consuming. What you'll also notice is you'll have more energy, your skin will look better, you'll drink less of the other beverages, and you'll feel a ton better too. Pretty cool things as a result of addressing water. So hydrating will wind up helping to reduce the dizziness and vertigo episodes that you go through. On to the next step. So if you're in the spins right now or having an episode of vertigo or dizziness, this is one of the most popular ways to wind up eliminating it. It's the semicircular maneuver, and we've helped hundreds of thousands of people around the world here on YouTube to wind up reducing their vertigo with it. So what I'm gonna do is walk you through all the steps of it right now. But I gotta let you know, if this doesn't wind up correcting the problem or our steps don't correct the problem, connect with me. We gotta get you to a professional who can help you because not all vertigos can be solved on your own. So with this, what you're gonna do is find a chair that has a back to it and arms. And what you're gonna do is you're gonna stand right in front of it with your toes going forward, and we're gonna hang our head down beneath towards our knee and just let your head hang. You're gonna stay here for about 30 seconds to a minute and make sure that you're not spinning at all, no spins whatsoever. And once you get to that 30 seconds to a minute, you're gonna quickly flip back into the chair and you're gonna just sit there. Now this is a great time to wind up doing a breathing exercise, and we'll talk about those in a few steps, but you'll just stay here for about 30 seconds to a minute as well. What this will wind up doing is help some of the crystals in your ear, if they're active, to wind up replacing themselves. Now keys to this, you don't do this on a bench, you don't do this on your bed. You may have noticed that I wound up flipping back in the chair, lean back a little bit. Thank goodness I had a back here or I would have been laying down, and that could wind up exacerbating your episode right now. So make sure you do it in a chair that has a back. Having hand bars or armrests, really important too, just to make sure that you can hold on and that you're balanced when your head is down. This is a really powerful tool, but it typically only helps about 50% of individuals. Stay tuned to the rest of the steps to wind up addressing the other 50% if this can be taken care of at home. If it can't be taken care of at home, go ahead and reach out to us. We'll do our best to find you the right person who can help resolve your problems and get you out of this episode. So for this tip, we're really it's something new we've added to a lot of our protocols for patients managing their vertigo in episodes. And this has really helped for them to cut off on the time that it takes to recover. And it's called acupressure. So these are some points throughout your body that you can wind up rubbing on that wind up helping to reduce the episode and get you over it quick. So the first thing is the technique that I like for you to do is to take 2 fingers, and we're gonna use them to rub in a circular motion on these points. The first one that I like to do is right on the crown of your head. It's gonna wind up being a little bit, almost from your ears, you go up and back to where they wind up meeting. You just rub on it in a circular direction for about 30 seconds. Now we're not gonna do 30 seconds here because I wanna get through each of the spots with you, but I want for you to do that at home. The second one winds up being on your traps, mid-trap. And that's going to wind up being, the trap is this muscle right here on the back of your neck that goes from your neck all the way out to your shoulder. And once again, 2 points, right midpoint on your trap on the left and on your right. The next one is the most common one that I guide people to, and it's actually right behind your ear. So you're going to use your 2 fingers, you're going to fall into the hole right behind your ear, and once again, you're going to rub in a circle. It might be a bit tender when you do this, so that'll judge the amount of pressure that you should put on it, but you want to continue to do it in a circular fashion. We'll do it on both sides as well to wind up helping those pressure points get back into balance. Next one up is going to be underneath the base of your skull on both sides, right about here. So you're going to use your fingers. You could do this one together. The previous one you want to do separately. The next step that we're going to do is on your wrists. We're going to go right in the midline, about 2 inches below the wrist, once again. If you're having episodes of this too, you can do this while you're also doing your deep breathing, and we'll talk about that in another step. Then the last one is going to be a little bit different than the one that was below your ear, but it's going to be right on top of your jaw. We're going to rub it in circles as well. These are some of the key places that you can use as acupressure points to wind up reducing the tension within your system, help you to get over that episode of vertigo and to get back to life. So you caught me doing what our next step is, and that's really focusing on breathing. Breathing is massively helpful into restating or re-triggering or firing off your parasympathetic nervous system. It goes through engaging your vagus nerve, and if you're interested in learning about how to reset your vagus nerve, check out this video where I went through my 5 steps on how to reset your vagus nerve. Now, breathing really helps with every cellular function in your body. We require significant amounts of oxygen in our body, so making sure that we're getting good breath is really important. When we get stressed, overwhelmed, or go through a difficult experience, you typically will notice that your breathing becomes shorter and shallower. You may also notice that when your posture is poor, that it's more difficult to breathe, and that breathing once again becomes shorter and shallower. Deep, full breaths help every tissue, organ, and your gland in your body to have the oxygen that it needs to do the work that it needs to do. So as you're going through a vertigo episode, breathing exercises can be outstanding in helping you to overcome them, get through them, and onto the other side. My favorite format for breathing exercises comes in the form of a box breathing. So the way that goes is that you wind up taking a breath in for a count of 4, then you hold it for a count of 4. You let out for a count of 4, and then you hold it for a count of 4. I'm doing it right now sitting Indian style, or crisscross applesauce as the kids call it. But you can do this in any position. You can do this seated in a chair, upright. You could do it lying down on your bed or on the grass outside. It's a wonderful place to do it. Just be careful that it's not too cold or that it's not raining and that there's no dogs coming around, because they might like to do something on you, and that's not going to make this very comfortable. So make sure you've got a nice safe place to wind up doing it. And we'll go through that box series, the 4 breaths, the 4-second in, the 4-second hold, the 4-second exhale, and then the 4-second hold 5 times. Now, I recommend you do this 3 to 5 times a day, just to help your body get back into those cycles of deep breaths, filling up your lungs all the way, expelling your lungs all the way, and getting great fresh air in. Now, we're going to do that together. And there's another step I like for you to take in really just connecting with your breath as deep as you can. So what I'd like for you to do is to put a hand on your chest and then another one on your abdomen. So when we go through and we do our breathing and we're inhaling, we want to feel both of your chest go up and your abdomen come out. Then when we exhale, you want to feel your hand on your abdomen go in and your chest come down. That says that you're fully expelling your lungs. So it goes just like this. We're going to take a deep breath in for a count of 4. We're going to hold for a count of 4. We're going to exhale for a count of 4. We're going to hold for a count of 4. Once you've gone through that cycle, once again, you'll go through it 4 times. If you want to add a degree of difficulty or even improve the process, you can focus on breathing in through your nose and then breathing out through your mouth. Another step that really helps to stimulate those nerves in your brain that helps you to shift to a calm state. Now, breathing is a massively important component and piece of the puzzle of managing your vertigo episode. Up next, we've got another step that's really going to help. So for this step, we're going to have a little bit of a doctor talk, okay? The next step to help reduce an episode of vertigo or dizziness winds up being some of the nutrients that you put in your body. This has to do with some specific ones, some antioxidants and some anti-inflammatories that can really help you to overcome the episode. So what I've found is that there are certain ones that are magical. One of the first ones winds up being some teas, particularly a ginseng tea. That can just help to calm the system and allow your body to get back to balance. Another one that I really like and I think is imperative to have in your diet and in your lifestyle is essential fatty acids, and I typically find them in fish oil. These wind up enhancing the cells, each cell in your body, as well as giving you the energy that you need and can help your body rehabilitate from any health issues. Lastly, making sure that you've got some powerful antioxidants will wind up helping to wind up reducing the episodes of vertigo that you have and get you back into life a lot quicker. Okay, so we went through our 5 tips on how to help overcome this episode of vertigo and the in-depth on what to do about them. If you're still having problems with it, go ahead and write me down below. It also may be important to connect with your primary care provider or the doctor you've been getting guidance on this to find out why this isn't taking care of the problem and to get a little bit deeper. If you want help, I'm always happy to help. You can reach out to us in the comments. If you know someone who's been suffering from vertigo, please make sure to send this over to them, especially while they're in an episode. If you've gotten out of the episode, sweet. Next thing you're going to want to do is check out our video on how to make sure that the next episode is a long time away and the steps for you to take to reduce the severity of next episodes if they can happen. Lastly, if you like videos like this, be sure to subscribe. And also, there's one secret tip you got to know about managing crisis and episodes of vertigo. Very frequently, the problems wind up stemming inside. So it doesn't have to do with a medication, a drug, any of the steps that we talked about here in preventing things from occurring, and you'll need a corrective chiropractor to help you with that. In that video I referred you to, we talk about it in more detail on how to take care of things for the long term to make sure that you don't have episode after episode. Because one of the biggest challenges that most people face is that vertigo occurs again and again, and the next time it occurs, it's way worse than the current time. I don't want that to be you. I want you to be in life, enjoying it, having fun, and fulfilling all the things that you want to do. And these steps will wind up helping you. If you want more help, reach out to me. I'm happy to help. Thank you for letting me be a part of your health.